Hello and welcome to What's Happening at Tri-City Medical Center. With us is Dr. Adib, a board-certified OB-GYN practicing at Tri-City Medical Center. She is here to talk about vaginal and facial rejuvenation. Welcome, Dr. Adib.
Thank you, Kelly, and thanks for having me here today.
Oh, it's wonderful. Okay. Wondering if we could have both on the same day. What is this, vaginal and facial rejuvenation you do in your practice? How does a woman begin to ask for these things? I mean,
yeah, that's a very good question. I mean, it's totally up to a woman to ask. I normally, after an annual exam, I ask them, is there anything else I can help you with? As you know, Kelly, the definition of health by WHO back in 1948 is a good state and healthy state mentally, physically, and socially. So when women come to me for an annual visit, I make sure that I address all the problems, and if I cannot address all their problems, I make sure I refer them to the right people who can address their problems. And one of them is how they feel about themselves, about their age, about their looks, how is their self-esteem, and what happened to them in life, in previous relationships, or in their workplace, and you know, how they feel it might be related to their success in life. So definitely I ask them, and I have actually, I believe there's a sign that if you like to talk to your doctor about it, if you're interested, make sure you bring up. So I do it in my practice.
I understand coming to your practice as a OB-GYN doctor, why I would come, and I'm going to just put vaginal rejuvenation for aside just for 1 second, but I would never think to talk about facial rejuvenation going to a gynecologist. And now, is this just something specific that you personally do, or have I been missing out? Should I have been asking my gynecologist for some facial rejuvenation?
Indeed, different type of doctors do the training session as long as they're MD, and even some dentists might have done these courses, and they offer it. So, you know, just doing the training courses and having previous experience with that, any type of doctor who is interested in those sort of treatments can offer them in their offices.
So it doesn't hurt to ask.
Exactly.
Now, I understand facial rejuvenation, vaginal rejuvenation. What do you mean by that? What is that?
Yeah. Well, after aging and also with multiple childbearing, the vagina may lose its strength or its previous shape. Same thing with external genital organs like the labia and external parts. They may get darker or change in shape, or just imagine childbirth like if you stretch a rubber band more than it could tolerate, and then when you release it, it'll never go back to what it was before. So same thing happens to vagina. It doesn't bother some people, but it does bother you know, certain group of people, or it may affect their sexual life. So what we can do in these rejuvenation is to basically construct the vagina and make it closer to what it was before these incidents.
So vaginal rejuvenation is not only, it deals with actually the physical, some physical alterations to it, is that?
Yes, it does. Facial, though, it involves mostly injections. We can also do facelift. We'll get into that, I believe, shortly. But in terms of facial rejuvenation, we want to know what stage the woman is at right now. People who are very much into themselves, they prevent to begin with. We have 250 facial expression muscles, and the more we use them, the more the lines happens on our faces. I'm sure you are aware of people, or you know people who, when they focus on things, they just frown, and it's their habit. And this habit makes them have two big lines over here, and they're not even 30 years old, and it makes them look angry or frustrated all the time, which is not true, really. So those type of things, or preventative, can be done by injections. But when the lines are too deep, or it's too long from when the lines has happened, or the women are too old, then the injections may not work, and really a facelift will be the best option. So the best thing about rejuvenation is actually to do a consultation visit with the doctor and voice the concerns, and based on what stage they are at, then the best treatment will be offered to them.
And what are some of the kinds of treatments for facial rejuvenation, for example?
Right. There are, in the earlier stages, there are fillers available to fill in like the deeper lines, like the smile lines over here. They best are treated with fillers. The facial muscles that move, like the frown or like claw feet or bunny lines, they are better treated with Botox or Dysport, so they're injections, if the lines are not that deep.
And what are the kinds of treatments for vaginal rejuvenation?
Yeah, there are certain treatments like laser treatments, and also doing actually a physical surgical procedure to tighten up the vagina or remove the darker parts.
And when someone wants to come in for the particular process of the vaginal rejuvenation, is it because they've come to you and they're like, you know, things feel a little wonky down there and I'm not quite sure what it is? How do they, I don't know if the word is get diagnosed, but how do they arrive that it's something that can be rejuvenated as opposed to some other kind of condition that might be more, I don't want to say health oriented, but how do you know the difference between getting the rejuvenation, or that it's something more serious that needs a medical attention?
Right. Rejuvenation is actually not exactly a treatment, it's a matter of personal choice. So the patients are the best people who will judge, or maybe their partners. Of course, if I see something that is totally off, or like something that is health related, like a lot of sagging or a lot of loss of strength in the vagina, I'll mention to the patient, because as I said, some of them are even embarrassed to say anything about it. But if they're fine with it, then we'll let them live with it. If they're not fine, then always things can be done about it.
And before we go, is there any final words that you would like to give to your audience about this topic of women's health and annual visits and rejuvenations and all of that?
Yes, I do. I want to message all the women about taking care of themselves. We normally give service to everyone and forget themselves. I see a lot of moms, working moms or single moms, that they are used to give service all the time and they totally forget themselves. And I really like them to look again to their lifestyles and cherish their life, cherish their health, and actually take care of themselves too, because what will happen most of the time, after they age a little bit and after they're done with whatever was their first priority, then they're left with depression, anxiety, empty nest syndrome. These conditions are about 9 to 10 times more common in women than in men. And that's because we just, give and we don't take as much. So my final words to all women on the planet is to cherish their health, their life, and think about their emotional well-being as well as their physical well-being, and always ask their doctor if they need anything or if they feel anything is wrong.
Thank you, Dr. Adib, for joining us. And if you are interested in finding out more information about women's health at Tri-City Medical Center, please visit tricitymed.org.